Stephen Hoff, Carrie Goat, Sigla Ligales, and Brianna Griffith. So, case study. A 65-year-old female is driven to the hospital emergency room with severe shortness of breath, cough, and fever. She is also complaining of muscle aches, stating, "It feels like I've been hit by a truck." She has a long-standing history of severe lung disease, chronic obstructive pulmonary disease, requiring a home oxygen because of a 45 pack a day smoking history. It is January and she is declining influenza vaccination when she is seen by her primary care physician in November. She is admitted to the hospital with a diagnosis of severe exacerbation of her chronic lung disease. The next day, her attending physician decides to test her for influenza. The test is reported back to the floor as a critical value because the results is positive for influenza type A. She is started on an antiviral medication for influenza. So question A, how is influenza contracted and what type of transmission would this be deemed? Most influenza infections happen through airborne route with viral spreads through inhalation of respiratory droplets from an infected individual when coughing, sneezing, or talking. Droplets can land on surfaces and then transfer to hands and port of entry such as eyes, nose, or mouth. This is called droplet transmission. It can also be transmitted through the air, making it an aerosol transmission, and ophthalmites, making it also a contact transmission.
Okay, I had question B. The patient is presenting with several concerning symptoms like shortness of breath, a persistent cough, and a high fever, which are all indicators of a respiratory infection. She also states that she feels like she's been hit by a truck, which is a common symptom in the viral infections such as influenza. Also, she has that history of COPD, which already compromises her lung function, and she relies on her home oxygen due to her smoking history. The signs that were observed in the healthcare team include the positive influenza test and then the exacerbation of her COPD, all which are big contributors to her respiratory condition.
Option C, influenza is a communicable viral disease because it affects the upper and lower respiratory tract. And since she tested positive for influenza type A, something she can do to reduce the spread of infection would be to avoid close contact with other people to avoid the possibility of spreading the infection. She should cover her mouth and her nose when coughing or sneezing, as it could prevent those around her from getting sick. And then wearing a mask, which is an essential prevention strategy that she can choose to do to further protect herself and others.
And D, what are examples of influenza antivirals? The CDC recommends 4 FDA approved antiviral drugs for for treating the flu. The first one is oseltamivir phosphate, also known as the brand name Tamiflu. This drug can be used to treat adults and children, including newborns. It can also be used to prevent the flu and to prevent the flu in adults and children over 1 year old who have been in contact with someone with the flu. The second drug is Zanamivir, which is also known by the brand name Relenza. This inhaled drug can be used by adults and children over the age of 5 years old. The third one is called Permavir, which is also known as the drug name Rapibvabe. Sorry if I'm mispronouncing these. These drugs are approved for adults and children over the age of 5 and who are in contact with someone with the flu. Valozavir Marnoxil is the fourth one, and it is approved for treatment for the flu by the FDA. The treatment is also known as Zofluenza, or Fluzat, excuse me. This drug is also given orally and is approved for adults and children over the age of 5. It is important to contact your healthcare provider as soon as you get the first symptom of the flu so you can start on a twice-a-day treatment.
Question 4, which is what stage of infection or illness is the patient currently presenting. So our patient is presenting during the acute stage of the influenza infection. The acute phase corresponds with the highest activity of the virus in the body, where symptoms are most severe in vulnerable patients like those with chronic lung disease.